So trying to give them as much autonomy as possible is really important. I always like to ask, would you like to have a conversation? Do you think that you can handle a conversation about advanced care planning, or what you would want someone to do for you if you're not able to speak for yourself? They may say no, and we have to respect that too.
You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello and welcome to the Oncology Nursing Podcast. I'm your host, Jaime Weimer, Manager of Oncology Nursing Practice at ONS. And today we're talking with Mandi Zucker, Executive Director of End of Life Choices New York in New York City, about how to have end-of-life discussions with adolescent and young adult patients, which is often abbreviated as AYA patients, about their choices. As a reminder, you can earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Welcome, and thanks so much for joining us today, Mandi.
Oh, thank you for having me. I'm happy to be here.
So to begin our conversation today, can we just start with maybe an overview of just the parts of an advanced care planning discussion and why advanced care planning in general is just a very valuable tool for all patients?
Absolutely. I think that everyone over the age of 18 should have an advanced care plan. And there's a lot of good reasons for that. I have 2 young adult children myself, a 20 and a 22-year-old. I know today we're talking about cancer, but young people are actually more at risk than other populations for very sudden life-changing events like car accidents, drug overdoses, things like that often leave you in an altered state very quickly, and you're not able to communicate your needs. So having documents for anyone over the age of 18 is really critical in those moments. And just like these tragedies that I just mentioned, cancer is not something that young adults typically plan for. And once the diagnosis is clear, talking about your wishes as you near end of life, or if you go through a complication and you're not able to speak for yourself, is much more emotional. Everyone should have a plan, and preferably come up with a plan before a diagnosis or a life-changing event, so that the people in your life know what you would want and what your values and wishes are.
Absolutely. And as you said, it isn't always a medical diagnosis. It can be other events, but, having the opportunity to think through and document what your wishes would be in any of those scenarios, I think is important to have as a baseline. And then if a serious health diagnosis occurs, then you can use that sort of as a foundational document that maybe then you would change when you understand the diagnosis, the prognosis, and kind of what lies ahead, that at least has a foundational document to start from. And these are difficult conversations. I think as a society, we aren't comfortable talking about death and dying and what that future looks like. So why do you think healthcare professionals, such as oncology nurses, are uniquely positioned to maybe initiate these discussions about advanced care planning with their patients, especially this adolescent and young adult population?
I think, oncology nurses in particular, but, healthcare professionals in general have a very unique, intimate relationship with patients. You're not just getting together to talk about who's playing what team next weekend in sports, right? Your relationship is inherently intimate. I know most of the nurses in my doctor's offices better than most of the doctors. So the trust that's required to have really difficult conversations may be stronger with the nurses than they are with the doctors. Also, as a non-family member, sometimes it's easier to hear information from nurses than it is to hear from your parents, let's say, or, a partner. Obviously, I would love for family members to be included in these conversations if the young adult wants that. But often it's much easier for these professionals to bring up the conversation, and it's easier for the patient to hear it from someone who's not, necessarily so close to them in their lives.
Absolutely. And I think even for oncology nurses, It's not always easy, or at least not always at first. And the longer that we spend practicing in the field and have these types of conversations more often, or even initially just listening in to when these conversations take place, maybe from, a seasoned nurse who is more comfortable or more experienced in doing this, or leaning on our physician colleagues and, observing and listening in on how they deliver this information or have these conversations. It's not as though it's inherently easy for oncology nurses to do this, but certainly with that experience and over time. And as you said, as you get to know your patients and develop that trust and that understanding that we do have that unique position to broach this subject when it can be difficult and uncomfortable for both patients and their family, their caregiver, their parents, if they're still involved, depending on the age of the AYA population. So I agree with everything you said. I think those are some great comments.
I was just thinking that I'm a social worker, and in all of my social work training, I never had a course on any of this. The very first time I had to have this conversation, I know I said the wrong things, and not because I wanted to, but it came from the best places in my heart, but I didn't know. So just because you're an oncology nurse doesn't mean that you have the training or skill to do it. Once I had the first conversation and I thought to myself, I think I could have done that better, I then went and got some additional training. And there's a lot of good training out there. So I would encourage people who think that these are things that are going to happen in their jobs to get some training. And you're absolutely right about the practice. You could practice with your own family, since I said we should all have these documents. So I assume if you're a nurse, you're already an adult. So you should have the documents, practice doing them, see what it feels like for you, talk to your own family about it, see how it felt for them. Those are really great ways to get more comfortable having these conversations.
Absolutely. I love that. And we'll definitely come back to some of the education and resources just a little bit later. But your message about this is a skill that can be learned and improved. And if you feel like you struggle with doing it and you're not great at it, doesn't mean you'll like it. It doesn't mean it's something that people are excited to have these conversations. But do know that, and I appreciate you calling that out, is that there are ways to get better at it. If it is something that you recognize will be a part of your role as a nurse, that, there are skills that can be gained and improved. So I love that you called that out, and we'll definitely revisit that topic here shortly. So when and how is it appropriate to discuss advanced care planning with adolescent and young adults?
There's a saying in this field, it's never too early to have the conversation until it's too late. And like I said, when my children turned 18, we completed advanced care plans with each of them. Obviously, well, not obviously, but thankfully they were, and they still are, healthy, and they didn't need an advanced care plan imminently. But that's actually the perfect time to do it. So we, had this conversation when there was no emotionality really attached to it. And that's the best time. Obviously, that's not going to happen for everyone. But really, the conversation didn't start with the day that I said to them, okay, you're 18, we got to fill out these forms. We had been having conversations a long time before that. We talked about things like in current events or TV shows or movies that they were watching. I tried to bring it up sort of naturally, like, we're watching SVU shows or Chicago Med. So we would watch some of these TV shows and I'd say, what would you guys do, if this was the situation for you? So we kind of had already gotten them starting to think about some of the things that might happen in their lives and how they would want to handle them. So I had an idea already what their values and wishes would be. And I think that's even more important, right, than actually filling out the forms, but knowing what their values are. So trying to have conversations in a sort of naturally occurring event is really great, so that big conversation doesn't feel that big.
I love that. And also just the notion of that it doesn't have to be like this big one-time conversation of that, as you said, in your example, talking with your own children, but that can also be transferred to when we're talking with our patients. And if we do, we have an AYA patient that we are caring for, understanding like, when can you insert some of those questions, as you mentioned, to understand values and to start to prompt them to think about their own values? Doesn't have to be doom and gloom from the very beginning. It can just be inserting the right prompts at the right times to encourage our AYA patients to just think about those things. If they have a diagnosis that we know is serious and the prognosis perhaps is a little bit grim, you still can have those early prompts and conversations without having to go all the way to the end of what that end of life will look like, starting it early and having that conversation over time and let it evolve over time, because I would imagine that it would be hard to be able to kind of reckon with that all in one sitting. Like it might be something that is easier to take off in kind of small bites. So I love those examples that you provided.
I don't know if this happens to you, but because people know what I do, friends and colleagues will frequently send me like a recommendation to watch a movie about death, as if I don't, deal with it enough in my profession.
You don't get enough of it. Yeah. Let's watch it for fun.
They think I want to watch it on, in my spare time too. But the reality is oftentimes those kinds of shows help me, right? I'm sure you've watched a movie because somebody told you about it that had something similar to a patient, right? Like, so maybe you're watching a show that, involves a young cancer patient, and you can ask your patients like, oh, did you see that show? What did you think about it? And it just brings up the conversation. So it allows them to start talking.
So what should nurses consider when they're helping their patients to complete an advanced care plan after a diagnosis, as opposed to when maybe, like we've given examples of when they're healthy, there's no, major health concerns or issues that they're anticipating. What should we consider when doing that?
I really think that it's important with young adults. Specifically, it's a time in their lives developmentally where they're, learning to be more independent, make choices. And then unfortunately, they have this big thing that happens that takes some of that autonomy away from them. So trying to give them as much autonomy as possible is really important. I always like to ask, would you like to have a conversation? Do you think that you can handle a conversation about advanced care planning, or what you would want someone to do for you if you're not able to speak for yourself? They may say no, and we have to respect that too. So rather than us sort of lecturing, we have a lot of information and we want to make sure that they have as much as possible. And at the same time, they can only handle as much as they can handle. So allowing them to make the choice, no, I don't want to have that conversation right now. Can we have it next week? Or, I'd rather you actually have this conversation with my mother. I don't want to be part of that. Or let's bring in my boyfriend or my sibling or whoever it is. So giving them choices and asking them, like, what do you think about having a conversation like that is really important. And then I like to use an acronym called WAIT, WAIT. Why am I talking? And frequently I talk because I'm nervous. I'm so anxious. It's such, as you said, like just because we have a little training and this doesn't make it an easy conversation to have. So I often notice that when I'm feeling anxious, I fill the room with words.
Same.
So saying to yourself, wait, why am I talking? And if you realize I'm talking because I'm nervous, I'm uncomfortable with this conversation, remind yourself to stop, because a little silence is not bad. It actually gives the patient a little time to think about the question. You've been thinking about it. You've been thinking, I have to ask this patient this question. They didn't know that was coming. So give them a second to just process and sit in a little silence to decide, do I want to have this conversation? What kinds of things do I want to ask? So just wait for a minute. I usually say, like, sing happy birthday to yourself. It seems like a long time, but it's not. I mean, these are really big questions and they need a minute. So, bringing up something, asking them a question, or saying, I was thinking maybe we should talk about advanced care planning, or who you would want to speak for you, and have a healthcare proxy conversation, and then just wait and let them go where they go, right? See what kind of questions they have and what concerns they have, so you can answer them rather than thinking what they need to know.
I always think, and I hate this, but this is not what I'm familiar with. And what I always made me cringe was like how this question is included in every admission assessment, every routine box checking, like, do you have an advanced directive? Do you want some more information? Here's a brochure. Okay, I've done my job. I follow the policy. That's not what we're talking about today. I get that is a requirement for certain, regulatory bodies and okay, fine. That is what it is, but that's not the right way, or that's certainly not the final way. I love how you just showed that this can't be just a box checking question to get through the form and move on with your day. This has to be a question that's asked at the right time, in the right way, with the right time available to follow it up. Because if they say, yes, I'm ready now, well, you better have the time to sit and talk more about it. And so I think that's important to make sure that even if, maybe it is a medical assistant or a care partner or an unlicensed person who is working through some of those questions as part of their routine check-in kind of rooming procedures. But we just need to make sure that the right person has the right time to follow up whatever their response was, because it just makes me cringe.
Absolutely. I actually really like that question is asked on the form. I think it's a good question to ask because frequently you walk into a patient's room and you're staring at a form, right? And you're going through like, okay, so this is when you're, whatever, all of the information that's completed on there. So when you get to that question, just like all of the other questions that you might ask, like, okay, so I see you don't have an advanced care plan. Would you like to talk about that? So that is a great way to bring up the conversation. They just filled it out on the form. So it's on their mind. Like, it's not like something you're bringing up out of the blue.
Timing is a good point. And so I think this next question is like, we might be asking this at their first visit because it is routine, part of that sort of rooming intake form, which is a great, like you said, a great intro. But that conversation, however it goes in the beginning, as the prognosis unfolds, after their performance status changes or their disease status changes, maybe they start to have progression, or we realize we have to switch from that curative intent to a more of a palliative or supportive care because we understand that the ability to cure or contain their disease might not be possible. So that if their disease state changes, then we have to then revisit that same goals of care discussion as well. So what considerations should nurses just keep in mind when they do have that patient who is experiencing disease progression or switching their goals of care?
So again, I think, the autonomy of the patient is really important. Some young adults are very on top of this planning. I think it's slow progress, but there has been some progress in that young adults are much more comfortable than a lot of us older people in having really difficult conversations. So we're the ones that are like afraid to bring it up, but some of them are much more comfortable. So we have to remember that each of these people are individuals and they may be very on top of this kind of planning or feel more comfortable having the conversations than we have. So it's important that we follow their lead and not make assumptions that because they're young that they haven't thought about their own death. They have cancer. I don't know anybody who has heard the word cancer that doesn't think about death, even if it's, a little mole that's going to be removed and you never need to think about it again. So most people have had this kind of conversation. We all know we're going to die. And to give them the respect that, they may be okay having this conversation, I think is really important. You don't want to miss an opportunity because you're making an assumption about them that they're not ready. They might tell you they're not ready, and that's fine. But we do want to try to have these kinds of conversations.
And I think it also serves as a great opportunity to make sure to validate that the patient themselves understands how their status is changing, how their disease status is changing. I think most oncology nurses have experiences and memories of patients where you truly weren't sure that they understood, or maybe they understood him and they were just, that was their coping mechanism of to kind of to deny it a little bit. And perhaps that's normal for every patient going through this transition and working through kind of managing those feelings and emotions. The worst scenario is for them to reach the end of their life and not truly understand that that's where they're headed or that's what's happening to them.
I think a great question to ask them is just like, what is your understanding of your diagnosis and prognosis? Because they may have heard it already. They may not have absorbed all of the information. They may not be ready to talk about it. So asking them what's their understanding, if they say, I'm dying, I know that, that makes the conversation a little bit easier, right? Than somebody who says,
having to tiptoe around like what they know and don't know. Absolutely. Just
exactly.
trying to establish that up front helps you understand kind of how to, what context are you having this conversation about advanced care planning? So absolutely. That's a great question. And I love, you've already given some great examples and some mnemonics and some just ways to start that conversation. Because I always feel like starting it can be the hardest part. So can you maybe walk us through a few examples of how a nurse could approach these types of conversations, particularly with adolescents and young adults? And what are some of those specific ways to open up those conversations?
So again, current events, I think, is a great way. Before, you even, they're just walking into your office, talk about like, what are the kinds of things that they like? Maybe there'll be something that sort of sparks something in your own mind. Like, oh, they watched that show. I've seen that show. I can think of an example that maybe we can bring up. There's also a bunch of I'll call them games that I really like. There's one called the End of Life Deck. There's another one. It used to be called My Gift of Grace. It's no longer called that. I think it's called the Hello Game. I'm not sure why it's called the Hello Game, but they're sort of like these coffee table conversation starter games. They look like, I'm probably dating myself, but like Trivial Pursuit kind of cards, just like a little deck of cards that you can just literally leave out on the counter and you can play them. So if you call them a game, it sort of just like removes some of that like big, scary,
heavy,
part of it, right? Yeah. There's some really good questions in there. There's one that I always like when I'm trying to help people determine who their healthcare proxy should be. It says something about if you were lost at sea, who would you want to determine how long they're going to look for you and when they give up the search? So they're just, sort of interesting questions. There's another one about like, what are some non-medical things that your doctor should know to keep you comfortable? And people might say things like, I don't like being cold. I want the room to be warmer, or I like, this kind of music in the background, or those kinds of questions that, help them, first of all, communicate what's important to them, but also like explore what their values are. If I can't listen to music anymore, that's going to affect the way that I feel about living. I like ice cream every night. If I can't swallow ice cream anymore, then that's something that I would not want to live anymore. That's when I'm going to decide not to do treatment, right? So those kinds of questions in a game form, I think, is often a little softer. And you could literally just like every time somebody walks in, say, before we start, we're going to play a game. We'll each answer, 2 questions and then move on, but it's just a way to open up the conversation. And not only does it help them to start sort of thinking about it, but it also lets them know that you're the person or a person that is willing to have this conversation. And that's important.
That's so important. You mentioned early on of, just in your own visits to your healthcare provider, how you kind of know the nurses and are maybe more comfortable with the nurses than with the doctor. And a lot of that is a function of the time you spend with them. And we know as nurses that, especially for patients who are getting systemic treatments, their visits are long, whether they like it or not, they're spending a lot of time with us. So we do have that opportunity. And, I think physicians, if the way that their clinics and their work process was set up and they could spend more time, I think that would be different for them. And they would have the opportunity to develop those relationships differently. So I think nurses are certainly lucky to have that ability to develop those relationships and that trust. And so I really love how you pointed that out is, you're setting the foundation for them to know that they can come to us with tough questions. And maybe it's not always this question, but, we're establishing that connection with them to say, I'm not afraid to ask you to talk about these tough things. And so I can be that person for you. I think that's just a wonderful message.
And, there's been studies that have shown that even if they have these conversations with non-family members, especially to start, it makes them more comfortable so that they can go home and say to their, the person that may end up being their healthcare proxy, or, the person that brings them to the appointments, like, I just talked to my nurse about this question and, I'm thinking maybe we should talk about it. So starting the conversation with them often leads to further conversations outside of the office.
What are some other strategies or processes that nurses can follow as they continue to have these advanced care planning conversations kind of over time with our adolescent and young adult patients?
I think we've covered a lot. There's asking questions and waiting and playing some of these games. There's also some really good resources that are available to young adults to make sure that they're documenting their wishes. We can talk a little bit about some of those if you want, having them available, again, like just out in the office, right? Like, when you walk into a doctor's office, there's frequently a bunch of brochures and things. So having them out there lets people pick them up when they're ready to look at them and maybe bring them inside. And you can say to the patient, like, oh, I see you have, one of those forms. Do you have questions? Should we talk about that? There's a great one called My Directives. It's a cloud-based app. And it keeps all of your directives, your healthcare proxy, your advanced care plan on the cloud. So you have it wherever you go. It used to be, I think, a long time ago, people would fill out these forms, probably not that long ago. I shouldn't even say that. People would fill out forms and then put them in the safe, right? Because they're really important forms. and no one would have access to them. So you'd end up in the hospital and no one would know, and no one would even know how to get them. So a lot of these newer resources are available on the cloud. You can even do like a video advanced care plan so they can actually hear out of your own mouth what some of your own wishes are. So My Directives is one. 5 Wishes is another one. It's a booklet that really encourages people to think about their values and choose a healthcare proxy, which I actually think is more important, the healthcare proxy, than the forms, because you're never going to be able to possibly come up with every single scenario that could happen. So you're not going to be able to document, like, if this happens, do this for everything. But having a healthcare proxy who you've had conversations with about what your values are, not necessarily about every scenario, but just about, again, like, I want to be able to eat vanilla ice cream. I want to be able to have a conversation. I want whatever it is, I want treatment. I want to live as long as possible. I don't care what it is or how much pain I'm in. Whatever your value is, you want to be able to have that conversation with your healthcare proxy so they can speak. I'm not even going to say for you. I'm going to say as you, so they can really advocate for you as if they were you, and making sure your values and wishes are respected.
I love that. And I think you brought up some great examples of how we document these and how we help capture and share the decisions that have been made has evolved and changed. And that, like you said, that sort of the old just paper in the safe or keep it in the freezer so you know where it is. Like, yeah. I think that doesn't really resonate, I think, with our AYA patients these days, because they do have so many other digital tools, app-based tools. The video thing sounds amazing because it just allows us to capture that information. But as you mentioned, it's knowing who you want to help enact those wishes, not just the document itself. I think those are equally important. So I love that you've given us some examples of just those things to keep in mind. And I also think, sometimes we include this information, like I said, it's part of the routine admission and somebody kind of tosses a pamphlet your way, which is, again, it's a way to at least get that information and that communication started. But, trying to sprinkle in this information in ways that, if they're not ready right now, or maybe it's not even like the time where that can be their focus, but always infusing and bringing up ways that, we can start to revisit it when it is the right time, planting that seed early. And so the first time they hear about it isn't when things now are super serious and it's extra hard, but planting that seed early and trying to cultivate that conversation over time so that it feels less scary and doom and gloom. We don't usually bring in patients and say like, okay, now is when we're going to bring you in to talk just about your advanced care planning. Like it's not supposed to be a standalone discussion and visit. It's part of integrating all of that into what their treatment plans are, how their disease is progressing. So I think those are just some great ideas of ways to sprinkle that in so that when patients are ready, that we can have that conversation and they have information to start with.
And if you have contact with non-oncology nurses, like general practitioners and those kind of nurses, have the conversation with them too, because even better is if they've had these conversations before a cancer diagnosis was ever part of their lives. So they walk into your office and it's already, started.
Well, Mandi, thank you so much. This is a big topic and we've scratched the surface today, but I think it is one of those topics that the more we bring it up and the more comfortable we as nurses become thinking about it and sort of planning for it, you want to be prepared so that when that patient comes and needs to talk about it, it's not your first time thinking about it either. I think we need to spend as much time investing in our training and preparation so that we can have that conversation and bring those patients through that conversation with as much skill and grace as possible. But we're human. And as you said, sometimes the first time, it won't feel like our best time, but dedicating ourselves to understanding that this is part of our obligation as nurses is to be able to skillfully, empathetically have these conversations so that, we can help patients identify what is most important to them and their values. So thank you for all the information that you've shared today. And as we wrap up our episode today, we like to just run through a little quick fire section of questions to help summarize some of the main points that we've discussed. So to start that off, how can oncology nurses evaluate their implicit bias or their hidden biases about advanced care planning for their AYA patient population?
Good question. I'll just say quickly, we all have bias. We haven't even met each other. I can't see you, but just hearing your voice, I make assumptions about you. We all do that, right? It's not a bad thing. It's just a thing. So it's really important to recognize that we have bias. We have assumptions about young adults. We have assumptions about cancer patients. So recognizing what yours are is really important. And then supervision is really key. I really do believe that it's important that we have ongoing supervision. Talk to your supervisor, your colleagues, your boss, whoever it is, about some of the things that come up for you. Make sure that that's not something that you're putting onto your patient as much as possible. Or if you do, to say, I recognize that I think that this patient, kind of reminded me of me and I acted like their mom instead of their nurse. And becoming more aware of when you're doing that will help you with the next patient.
I really love that idea of asking someone to kind of reflect back to you, like, what did you see? Help me be more aware. Certainly we can do that ourselves by pausing and just trying to reflect on that. But sometimes having an outsider who's observing, your interactions or your behaviors, being sort of humble enough to ask for that direct feedback can be especially meaningful. So I really appreciate and thank you for bringing that up. What are some common misconceptions about advanced care planning for AYA patients with cancer?
Well, first of all, that it's not necessary because it really is necessary. I'm a parent, as I mentioned, of young adults, and I've probably said maybe once a day, like, it's my kid, I know what they need. But the reality is we don't. And I think we all sort of make assumptions that we know what they need or what they would want. And we really don't. So we need to be so careful about making assumptions like that, knowing that they have their own value system beliefs. They're emerging. They may change. That's totally fine. But we have to be respectful of the fact that they have desires and want to make sure that, they have an opportunity to communicate them.
What's something about this topic that's not often discussed, but you wish people knew more about?
Young adults and adolescents, they're not big children or little adults. They have their own minds and concerns, and they need to be informed as much as possible so that they can make decisions that are best for themselves. When you're afraid to have the conversation, remind yourself that it is really important that they're making choices coming from an informed place.
What additional training or education do oncology nurses need to help support their AYA patients with cancer in this advanced care planning discussion?
I think I alluded to it already, but like any training on communication or listening, can never get enough of it. I really thought for a long time I was a good listener. And then I took some training on listening and I realized I was an okay listener. But taking training and really practicing, I really think of listening as a practice. So we're never going to be perfect at it, but learning, practicing listening skills is critical when you're talking about, an individual's life.
Absolutely. And one resource I stumbled across is Vital Talk. It's a website, vitaltalk.org, have lots of great courses and resources. They have an app even just to help, they provide a lot of those discussion prompts, like starting prompts of like, how do I start this conversation? How can I think about that? So that's one tool that I've found especially helpful in my practice. What are some additional resources for patients? Or like we mentioned, other nurses, maybe not oncology nurses who want to learn more?
There's a great resource called the Conversation Project, and I would encourage nurses as well as patients to check that out. It really does offer a lot of good resources about having conversations about advanced care planning. I mentioned the End of Life Deck. The End of Life Deck and the Death Deck are great resources, as I mentioned, for nurses to use to start conversations with patients, but it's also a good thing for patients to have in your own home. Play the game. I know somebody, she was older, she was 60 and in good health, but decided from her 60th birthday, she was going to play I think it was the End of Life Deck with her friends. So having those kinds of resources available to make these conversations a little less scary is really important. And then, of course, there's the National Hospice and Palliative Care Organization, nhpco.org. They've got a lot of great resources on their website. And so do we, endoflifechoicesnewyork.org. We've got a lot of great resources as well. So I would check all of those places out.
Wonderful. Well, Mandi, thank you again. Such a hard but important topic. And I so appreciate your time and expertise in sharing your knowledge with us and our listeners today. Do you have any final comments to share?
I would just say thank you. I appreciate, the time and having the opportunity to talk about this really important topic. I think young adults often get left out of end of life conversations, and I'm glad to be able to spread a little bit more awareness about the importance of them.
Wonderful. Well, thank you so much.
Thank you.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.